Thank you for joining us on the Voice of Pancreatic Cancer podcast. I'm your host, Miranda Weinberg. And if you don't know about the Sina Magwitz Foundation, we're a nonprofit that's committed to the awareness, prevention, and cure of pancreatic cancer. I'm very excited to welcome with me two ladies from HonorHealth Research Institute today. We have Gayle Jameson. You may recognize her. She's a familiar face, and she's been with us before. She is a nurse practitioner at HonorHealth, as well as a clinical investigator. And today we also have joining with us Terri Taylor, who is a registered dietitian at HonorHealth. And welcome both of you ladies. Thank you so much for taking the time to join us today.
Thank you, Miranda. It's really a pleasure to be with you today and to have the opportunity to discuss this very important topic of nutrition in the care of our patients with pancreatic cancer. And I have the privilege today of sharing this conversation with Terri Taylor, who is just a very skilled, very experienced dietitian who's also board certified in oncology, who has helped so many of our patients over the years. So thank you, Terri, for participating in the conversation today.
Oh, the pleasure is all mine. Thank you both for this opportunity to really share some information about nutrition and pancreatic cancer.
Well, we're excited to dive in. I mean, Gayle, why is nutrition such an important topic in regards to pancreatic cancer patients?
So the pancreas is a digestive organ, and it's very important in how we absorb food, how we metabolize food, how we maintain our weight, maintain good nutrition. And most people never think about their pancreas. It's hidden deep in the abdomen. And if you've never had pancreatitis or any problems, one never thinks about the pancreas or what does it do. But with the diagnosis of pancreas cancer, it's like, what is this organ and where is it and what does it do to keep me healthy and why isn't it working properly? And what the pancreas does is really two very important bodily functions that aid digestion and how we use our nutrients. One, of course, is producing insulin. And many people are familiar with that because diabetes is a common problem that we have in this country and across the world. So the pancreas produces insulin that helps us metabolize and utilize our blood sugar or glucose, as we call it. And the other very important, I think almost hidden function of the pancreas is that it produces an enormous amount of digestive enzymes. And if there's any illness in the pancreas, it's not only pancreas cancer, but it could be pancreatitis or some other issue. If the pancreas is not producing these important enzymes, people will develop a lot of symptoms. They can develop, and these, by the way, are common symptoms of pancreas cancer. It can be abdominal pain. It can be that problem of not feeling comfortable when you eat, or, I have patients who they rub their belly after they've had a meal. They say it just feels bloated. It feels uncomfortable. Some people get terrible diarrhea. Again, these enzymes are so important, and weight loss as well. We see that being a problem many times in this disease. And weight loss can be due to not absorbing these nutrients appropriately. And there are three main enzymes, and we'll talk more about this later, but there are three main enzymes that the pancreas does produce that aids digestion. So Terri, you see many patients with pancreas cancer, and Terri also sees many patients with other types of cancer, but again, has helped us so much, and she's really an expert in nutrition with pancreatic cancer patients. So when you see a new patient, somebody who's just diagnosed, how do you begin that conversation with them? And do you involve family members? How does that all evolve in that conversation?
So oftentimes when patients present to me, they are going to have vague symptoms that they've been experienced or, intermittently over the past few months. And some of those are things that you've just talked about, Gayle, things like abdominal pain with eating or bloating or excess gas or feeling full quickly or losing some weight when they weren't intending to. And so, but they really don't put that all together until they're diagnosed. And as you mentioned and explained so beautifully, we do know that the pancreas is very, very integrally incorporated into the digestion of foods. So when I meet with patients to begin with, first I do have to say it's very disheartening for me to see so many patients from across the country and here in our area that have not seen a dietitian at all from the onset of their diagnosis. And nutrition is a really, really important part of their treatment plan and their quality of life. So I just really want to point out the importance of meeting with a dietitian, especially one who is focused on oncology nutrition, and continuing to work with them because things change along the way. You know, they might have initial symptoms and then we add in things like treatment, and that changes the way that they can process foods or things that they can eat. So it's an ongoing process. When I first meet with patients, I do like to involve family members or caregivers as much as possible, because when we think about food, food is really something that we all are familiar with, and it's a really important part of our lives and a very personal part of our lives. And when it gets disrupted by the way the body's using the nutrition or nutrients, it is really, really difficult and frustrating for people. And loved ones often, as you've seen before, they like to use foods as a way of showing comfort or love or things like that. But we don't want them to be nagging people or, making them frustrated about eating. There should never be any conflict about food. So when we get together, we talk about what the issues are. I listen to them and see what kind of symptoms they're having, and then try to find out what ways and come up with suggestions on how we can manage those and make things a lot better for them. Some things that I have really found, again, is that when patients come to me, probably their first question is, what should I eat and what shouldn't I eat? And as we all know, there's a lot of information out there on the internet. There's information from other people or experiences, and it's hard to sort all of that out. So in my experience, I really like to keep them from being so confused, give them direction on what to do, sort out those things, answer their questions, and most of all, make this a plan that we're all going to be able to work with to meet their goals and then to make it livable for them.
So that seems like, obviously probably one of the first questions that they would ask. What are some other frequently asked questions that you get at that initial visit?
So some of the other things they will ask about supplements, they'll ask about sugar, is that something that's causing my cancer? Those are things that are common questions. So when we're talking initially at a consult, we really, again, want to talk about their symptoms and what's been happening. Very important that we are coming up with the dietary and nutritional guidelines to alleviate some of those symptoms. So maybe it's in the patterning of their meals. Is it better for them to be eating more often, smaller amounts? Is it better for them to be restricting their eating for a period of time to address some of these gastrointestinal and digestive issues? Also, we're going to be throwing in probably some type of treatment for this type of diagnosis. And so that can add a whole nother layer of things that can affect their nutrition, because maybe it will affect their appetite, again, affect the way that they're digesting foods, affect their energy levels, and many of those things. So we really want to proactively manage those treatment side effects. We want to give them ideas to prevent those. And being part of the team, being the dietitian as part of the team, we're working together with their foods and their supplements and their treatments and their medications to help to do that. Something that's very important that I think people forget is that we are looking at the composition of their body as well. We all know about weight and body fat, but something that has been kind of under-focused and that's really coming to the forefront now is muscle composition and maintaining muscle mass. We do have patients that have lost weight prior to their diagnosis or even during treatment. But not only are we looking at their weight loss and trying to address that, but we are looking at what is the composition of that body. Are we preserving their lean body mass? And we know that treatment outcome has been correlated with better treatment outcome is correlated with better preservation of muscle mass. So when we look at the macronutrients, we look at the protein, finding out how much protein they need and getting that in, and the quality of the protein. And we'll discuss that in a minute, but very, very important that we're doing that and including activity as part of that as well. And then what I like to discuss is when we have patients that are doing fairly well with their eating and managing their side effects, let's look at how can we create an environment in their body that pancreatic cancer cells don't like. We are giving treatment to try and manage that and get rid of those pancreatic cancer cells. So let's try and do eating things, nutrition guidelines that can really help to make that treatment even more effective. And again, create an environment that pancreatic cancer cells don't like. And as I mentioned before, this has to be livable. It has to be something that people can sustain and that they can work with, not something that here's a piece of paper and go do this and, go ahead and if you can't, too bad. We really want to make this individualized. And that is the idea of tailoring it to what their lifestyle is, what their preferences are, and then what their treatment and other comorbidities are as well.
So thank you, Terri. Those are really important and helpful points that you make. So what specific diet do you recommend to our patients with pancreas cancer?
So I think it's important to think that this isn't a diet per se. This is an eating plan or an eating pattern. We know that there is not one single food or one single meal or one single nutrient that is really going to be the tell-all or the most important thing. It's the pattern of eating. And always keeping that in mind because, there are going to be times when, certain foods sound really good. And so you're going to have that and move on from that meal. But we look at dietary patterns. And so one of the things, again, is in meal patterning. So oftentimes because of the early fullness or maybe to meet their nutrient needs, meaning getting enough protein in and getting the calories and fluid in, it's very helpful to be eating small and frequent meals throughout the day. And not to think that in one meal can you get all of the protein and calories and vitamins and minerals that your body requires and that your body needs to support itself during treatment and beyond. So that is one thing. We also look at the balancing of food. So when we look at what we call macronutrients, these are the main things that you may have heard of, things like protein and fat and carbohydrate. We really want to balance those when you're eating. As I mentioned before, muscle mass, body composition is very, very integral to outcome and quality of life during treatment. So protein is a very, very important macronutrient that we start and focus on. So the idea is that your body only uses a certain amount of protein at one time. So when you have higher protein needs, in order to reach that amount, it does need to be divided during the day. We look not only at the quantity of protein, but also the quality of protein. We do know that animal versus plant protein, it's good to have a balance of both. Plant protein may not be as complete or utilized as much or as well in the body. So to do a little bit of animal and plant protein together is usually the way that we go. If we have someone that is, has a preference for being vegan or vegetarian, then we of course modify it for that. So the idea is enough protein during the day. Every time that you have a meal or snack, you do want to include a protein with it, a protein and or a fat. We ask that you really not eat carbohydrate by itself because when we look at blood sugar control, and we're not saying that people definitely have diabetes with pancreatic cancer, but we do have some concerns when there are spikes in blood sugars during the day that the pancreas has to make a lot of insulin to bring that blood sugar back to the normal range. And when it's creating that insulin and putting it out in the body, other hormones are going out that potentially could be cancer promoting or inflammatory, which again can promote cancer cell growth. So we like to have protein and or fat with the carbohydrate. And by carbohydrate, I mean things like fruits and vegetables, grain products, those types of things, because again, that's going to help to keep the blood sugar more even. In choosing carbohydrates, things that are more refined carbohydrates or what you may refer to as white flour products or high sugar products, those things tend to spike the blood sugar more quickly. And again, if you're eating those by themselves, then some of the hormones go out that potentially can make cancer cells grow. So we really like, again, protein every feeding, no standalone carbohydrate. In choosing carbohydrate, there are things that are more slowly digested, so things that have fiber, and examples of that would be some whole grains or fresh fruits and vegetables. If people are having treatment side effects, things like diarrhea, then we would modify the type of fiber so that we don't aggravate that situation. And in talking about carbohydrate, I do want to bring up that question that I hear all the time that we see a lot of press on is, does sugar feed cancer? And, since I have a cancer diagnosis, does that mean I have to give up sugar altogether now? And what we are looking at, again, is the effects of eating too much sugar in our bodies. It's not that 1 teaspoon of sugar is going to be, again, the end all. We're looking at what's happening if you're eating a lot of those refined carbohydrates or high sugar products or sweetened beverages that make the blood sugar spike very quickly. And as I mentioned, then some of those hormones that go out with the insulin can actually be kind of a negative effect in the body. Or we think about eating a lot of processed foods and foods that are high in sugar, and maybe those are taking the place of eating some healthier foods that may be providing some natural compounds that actually work to kill cancer cells and support the body. And perhaps when we're looking at prevention, if we have people that are eating lots of high sugar foods and lots of processed foods and they're gaining weight, and we know that being obese is a risk factor for many cancers. So it's very narrow-minded to say just that sugar feeds cancer. It's looking at how much refined carbohydrate and how we're pairing that and eating it throughout the day. And then we look at fats, and this probably will lead to our discussion about pancreatic enzymes. But we know that one of the major macronutrients that have problems with being digested with pancreas cancer can be fats if you're not producing enough of those enzymes. So the idea is to really get on the correct dosing and the type of pancreatic enzyme that's best for you and for your financial needs. And then from there, hopefully we can liberalize the fat some in the diet. If you had pancreatitis or you were having a lot of nausea or a slowing of your digestive tract or a lot of diarrhea, then maybe we would look at how much fat. But again, we really like to use the enzymes to try and mitigate problems from eating fat so that we don't eliminate that as a calorie source.
So when you talk about, having a small complete meal throughout the day, could you give like an example of something that you would recommend, like as far as the type of foods, just to give people an idea?
Sure, I'd be happy to. So in looking at that, let's say if we were looking at breakfast, a protein source might be eggs or egg whites as the protein source. And with that, perhaps you would do a piece of whole grain toast with some butter on it, and then you could do some fresh fruit. If you wanted to do something like a low sugar Greek yogurt, and again, put berries in it and put nuts in it, that would be an example of something like that. If you were doing something in a dinner, it could be something like, I'm going to do chicken and I'm going to do stir fry kind of vegetables with it and some brown rice, or doing something along that line. Snacks, again, could be fresh fruit and an all natural stir type nut butter, something along that line, to give you some examples. Also, there are protein drinks out there that we often use as ways to supplement protein intake and something easy as a snack. So things we're looking at that when we look at labels of those products are they, again, low in added sugar? And I guess I should qualify that. When you're looking at labels, we're primarily looking at added sugar as being something to watch out for, not looking at total sugars, because that could include some of the carbohydrate in the food. So in a protein drink, or perhaps looking at one that has a higher protein item that's moderate in fat, and we're looking at the type of fat, not a lot of processed fats, and then something that's a little bit lower in added sugar.
Thank you, Terri. These are very important comments. And we both have been working in the field of cancer for many years. And I certainly remember the day, and unfortunately, I still hear this once in a while, where people will say, I was told just to eat whatever I can, eat as much as I want. I shouldn't lose weight. And, this may be somebody who's 250 pounds. And certainly the science has changed. You talked about these hormones and growth factors and insulin, and those are all so important factors. And we no longer say that. We don't say just eat. We say, see the dietitian, and they will help what are the appropriate foods to eat. And, we know that lean is better, and not that being on chemotherapy or having pancreas cancer is a diet plan or, lose weight plan. But we do know that people who are doing well and living longer maintain that lean muscle. And if we have people who've changed their diet, they're eating better, they're exercising more while on therapy, and this happens all the time, people may lose a couple pounds a month. And that can actually be healthy weight loss because they're losing excessive fat. And so I think that whole mindset has changed over the years.
And that's something I was going to follow up question with you as well, Terri. You talked about the focus kind of being more directed towards that muscle mass. How do you counsel people on diet as well as exercise and that combination? And do you get that question a lot?
Yes. So, it does take those two things together. It's not just eating protein, but it's the activity that you do as well. So my role as part of the team and with the team, we really reinforce with each other the importance of getting enough protein, but then combining that with some physical activity. So we typically recommend, and I will tell them to go ahead and include activity, to do some resistance things that they're capable of doing. It doesn't mean, they have to, go somewhere to do that. It can be as simple as doing some light weights while they're sitting or doing some bands while they're sitting. But we do know that resistance exercise really helps to maintain that muscle mass. And the other thing is the timing of the protein as well. If you are doing activity, to get some protein after doing that activity helps you to maintain that muscle mass that you work so hard to preserve. So the timing and the quantity is very, very important.
And do patients need to be careful of the balance, like as far as burning calories, if they're, like you said, struggling with effects of treatment and trying to get all of that intake?
So if we do have clients that are having a tremendous amount of weight loss, which again, we don't want that to be happening, but if we make sure that they are covering that with enough calories afterwards, then that should help to mitigate that unintended loss of weight if we don't want that to be an outcome. The other thing is in doing it, many people are living their normal lives and being active, and all of a sudden they're diagnosed with pancreatic cancer. And perhaps they've been doing an hour of activity a day or something like that. We might scale back that time that they're doing or the expectations for them. So number one, they're not frustrated by, I can only do 10 minutes of exercise now. And, I should be doing an hour. No, it's scaling it back to what they can do, maybe dividing it out during the day, doing something a little less intense so that they're not getting really tired, because fatigue can be a side effect from treatment. And fatigue isn't a time to just do no exercise, but instead to do that to help increase the endurance, improve their endurance, and coupling that with getting enough calories and getting rest and staying hydrated, because hydration can have a big impact on their level of energy as well.
So let's talk about some of these symptoms. And Terri, you have a lot of really helpful dietary recommendations for some of the symptoms that people have related to their disease and or related to their treatment, be it chemotherapy or radiation therapy. What I'd like to do is just show a picture, because when we talk about the pancreas, again, a lot of people don't really know what is that. I have a picture here of some of our digestive organs. And if you see on the top, we of course have a body where you see where these enzymes or you see where these organs sit. But then if you see on this area here towards the right, you can see the liver, you see the gallbladder that sits under the liver, you see the stomach, you see the pancreas. And the reason I want to show this to you, and again, we're looking at a person. So right and left are backwards. Our liver's on the right side, our stomach and pancreas are more on the left side. But if you look at this enlarged area here, you'll see the pancreas. And when we talk about secretion of digestive enzymes, you can see that there are these tubes or these ducts that are within the pancreas. And as these enzymes are produced, they travel down this pancreatic duct. They join with the common bile duct that comes from the liver and the gallbladder, and then dump here into the small bowel. And so that's where those enzymes land. So when you eat your food, you chew it, it goes into the stomach. The acid there helps to break it down. It's mechanically broken down, and then it goes into the small bowel. And that's where those tiny molecules need to be absorbed. And so when we talk about this dysfunction of the pancreas, then if there are not enough enzymes, and it could only be a 10 or 20% reduction in the amount of enzymes being produced. So the pancreas is still making enzymes, just maybe not enough. These symptoms can occur, as I mentioned before, such as bloating, abdominal discomfort, cramping. Some people have profuse diarrhea. We've had patients who present with up to 20 liquid bowel movements a day. And the interesting thing about this is if we replace these enzymes, so there are three important ones. Fat is an important nutrient to be absorbed. Otherwise, there are a lot of these symptoms. Lipase is the enzyme that's produced that helps absorb fat. Protease is an enzyme that helps to break down and absorb the protein. And then amylase is for carbohydrates. So these three are all very important. When we recommend supplementation, we recommend prescription grade enzymes. And the reason we do that, there are a lot of over-the-counter products out there, but we know in the prescription ones, we know the percentage of these different enzymes that are in the capsules. We have a reliability that the FDA, assures us that these are what they say they are. And they're tolerated very well. And typically what we'll do is we do a trial. We'll just say, take these for several days and see if your symptoms improve. It can be dramatic. I've had patients tell me it's life-changing. This one patient who was having 20 diarrhea stools, it took us a while to get us on the right dose, but he went down to 1 or 2 stools a day. And so these enzymes can be so vitally important. Now, what about the patient who does not have symptoms, but their protein levels are low, they're continuing to lose weight? They still may not be absorbing the appropriate amount of these nutrients. And so we really stress this. And I have to say, this is probably, at least in my clinical experience, that this is one of those symptoms or scenario symptoms that are often missed. And so it's very important for patients to be aware of this. And I'm not saying everybody has to be on enzymes, but our experience is the majority of people with pancreatic cancer of any stage really do require some enzymes. The way they are taken, again, they are prescription, and it's recommended that they're taken with the first bite of food, whatever the dose is, and then it travels with the food into the appropriate spot in the duodenum for absorption of those nutrients.
And is there really any negative effect to taking enzymes? I mean, or is it just purely positive? I mean, adding that supplement to their diet.
There are very few side effects. I've occasionally had a patient say, I think it made me constipated, but there are so many other drugs that we're giving during treatment that can also do that. Generally, they're very well tolerated, but I will say that they are financially toxic, meaning that some insurance companies do not cover these and they're very expensive. And that can be very frustrating and very limiting for patients. And that's one of the things I think we need to work on with Medicare, because many of the Medicare programs do not cover digestive enzymes, but they are so important to maintaining good nutrition and quality of life.
And do they make a generic, or is it's not very accessible?
Terri, I'll let you address that.
So my understanding is that there is not a generic product for that. As Gayle mentioned, there are over-the-counter products that say there might be digestive enzymes or pancreatic enzymes. But then when you look at the composition of some of those enzymes that Gayle mentioned, especially the lipase, the amounts are so small that they really aren't going to make an impact on improving the absorption of their nutrients. I will say that some of the drug companies do have patient assistance programs, which we can access as well. And so as much as we can, if we can find them resources to help with those things, that's very, very important. They do have a huge impact, again, on their nutritional status, meaning they are absorbing their foods better, on their GI symptoms, managing those things that Gayle mentioned, and also on their quality of life, because again, they aren't having all these trips to the bathroom and things like that. So they are very, very important. The other thing, we're dosing them. We want to make sure we're dosing them correctly, because some people, their physicians might prescribe some, but they're very underdosed. And so when they're underdosed, they aren't really being effective as well. So we base it typically on their body weight, their GI symptoms, and then we adjust them from there. The other thing that I do want to point out is there has been some recent research that looked at medium survival with pancreatic cancer on people that are taking enzymes and people that aren't. And in the small studies, it has shown that people who are taking enzymes had a longer median survival with pancreatic cancer. And I believe it's probably related to the fact that the people that aren't taking enzymes become malnourished because they're not absorbing a lot of the vitamins and minerals and macronutrients. So it's not just, oh, this would be a good thing to do. We do know that it can have some really positive impacts on their symptoms, their quality of life, and their outcome.
So, Terri, what other suggestions might you make for a patient who's having changes in their bowel habits, be it due to disease, due to chemotherapy? Again, I know you have non-medication recommendations that have been very
tricks up my sleeve that I can share. The tricks up my sleeve.
You're a constant.
But of course, they are research-based. It's not just, this would be a good thing. But
in your experience,
yes.
With all that experience, it comes some wisdom. So please share.
If we're looking at, we have to remember that enzyme insufficiency is one issue for causing diarrhea or malabsorption. But then again, when we throw in the other wrench of some chemotherapy regimens where their side effects can be diarrhea, we're dealing with a different issue. So not only making sure that they are appropriately dosed on their enzymes and they're taking them appropriately, as Gayle mentioned at the beginning of their meals, but also then we need to go a step further. So sometimes there is a carbohydrate called lactose that sometimes people don't tolerate very well, that's found in some types of dairy products, milk in particular. So perhaps scaling back on the lactose and getting some products that are low in lactose to see if that helps with some of the diarrhea and bloating and gas. Also, the idea of the type of fiber that they might be eating. So there are different types in fiber. There's types of fiber in foods. One is called insoluble fiber, and that's the type of fiber that stimulates your system to work. And that would be in things like bran or peelings of fruits, raw vegetables, nuts and seeds and those things. And then there is a type of fiber called soluble fiber, which I call like the sponge fiber. And that's the fiber that actually binds the fluid in your gut to slow down some of that diarrhea. So there are foods and products that are higher in soluble fiber. Some foods that are higher in soluble fiber would be things like oat products. So again, if we were talking about protein and carbohydrate together and then throwing in this idea of doing soluble fiber, it would be, okay, maybe I'm going to do an egg or a higher protein milk and do some oats and then do banana, which is again a soluble fiber. And that will help with the diarrhea and meet our guidelines of the protein and the carbohydrate together. Another thing is there are some products out there made from banana flakes. And banana flakes have been shown to be very helpful with minimizing loose stools and diarrhea. So I've been having some really good success with that and sometimes doing that proactively. If we know people have a history of bowel diseases like colitis or something like that, and they're going to be on a regimen where they can have more diarrhea, starting that right away can be very helpful as well. And then sometimes, again, looking at the total fat can be sometimes helpful for people that are having more diarrhea. So looking at lactose, looking at enzymes, looking at the types of fiber, and working from there. There are also soluble fiber supplements or powders that you can buy and incorporate that into your daily nutrition plan as well. Very important, though, when these things are happening, that you're getting enough fluid, because we need to keep that hydration going, because some of these fibers, again, are going to be binding some things and you need fluid for them to work better.
So what about nausea? And I will say that thankfully over the years, we've gotten better in terms of medications to help prevent nausea or treat nausea. And, most recently over the last couple of years, a really important medication that we are now using, and it's evidence-based, good studies that I will share, is that drug of olanzapine. And olanzapine historically was approved years ago for treating psychosis. But in small doses, it's been learned that it helps nausea not only related to chemotherapy, but even the nausea related to the disease. And we have had really good success using olanzapine in addition to the more traditional medications. And so I share that because if there are patients out there who are having difficulty, that's a good question to ask your physician or your advanced practice provider. Would adding that drug maybe help if it's a chronic nausea situation? But Terri, what do you recommend regarding nausea?
So Gail, that's a really great point to bring up again about really not having as many issues with nausea as before. I think you have seen in your practice as well as myself that, before it used to be nausea was the big fear and the big question that people would come with. And now because the medications are so more effective, I think it's not as prevalent and there's not as much of a fear. And for patients to really bring that up with their practitioners, their physicians and nurse practitioners, if something isn't working, there are a lot of other options out there as well. When I look at nutrition, some of the things I'm looking at is, again, eating smaller amounts more often. Some people think that having no food on their stomach is a good idea if they're nauseated, and really it's better if they do have a little bit of food on their stomach because that helps the nausea. And that doesn't mean going out and having like a fast food hamburger or something like that. It's like doing something that's a little bit, easier on your digestion. Again, maybe it's, some soup, or maybe it's some cereal, or maybe it's an egg and toast or something like that, something a little bit drier, a little bit saltier as opposed to sweet is better. Having success with using some ginger products as well. We do know that ginger products can help with nausea, so perhaps it's using, a ginger tea or something along that line, or adding ginger to a smoothie to help with the nausea with that as well. Also, the idea of smells of foods. Sometimes smells can be overwhelming and that can create that sense of nausea. So perhaps things that don't have a lot of odor, not a good time to be, cooking Brussels sprouts in your kitchen or something like that. Or maybe the meat should be cooked outside, or maybe it should be in a crock pot or something where there isn't as much smell. But again, smells of all kinds of things. It can be cleaning products, or it can be, perfumes or things like that. So looking at that can be very, very helpful in reducing those types of nausea. And also the idea of what we call anticipatory nausea, where people are worried and upset and going for their treatment, and they're just, anticipating being nauseated. So working on things where it might be breathing, or maybe, doing some visualization or some meditation, or some people will use some AccuBands or acupressure bands to help with nausea as well. So we want to use whatever types of modalities and practices we can to make sure that this is not something that's going to impact their intake or the way that their quality of life is.
And most of those that you mentioned are very easily implemented things that they can have access to at home or at their local grocery store. So I'm sure that that's a relief.
Going to some special place or anything like that.
Yeah. Well, great. And then something that I thought was interesting, I mean, you kind of touched on it at the beginning, but what about those days that for people that are on, more of the regimented diet, if they want to have a cheat day or something like that?
Yeah, so again, just remembering that it's not a single meal or a single food that's going to be a problem. So, we look at, more of the time, fine, but there are going to be times when, you want something, or you're going to your favorite restaurant, or this is the only thing that feels good. So again, there's no guilt with eating or nagging or conflict with other family members about it. If it's something that you want every day, then I work with people again on patterning. It's like, oh, I always want to have, my cookie at night. So it's like, okay, well, how are we going to do that? Because that's an important thing for you, and that's not going to be a problem. So, maybe if we, pair that with milk, then we've got the protein and the fat to bring down the rise in the blood sugar. So that will help some. Or maybe it's adjusting the ingredients and how they're cooking with those items. Maybe we're going to use some different types of fats or different types of flours or sugar alternatives in order to make that something that might be a little bit more in line with some of the things we're talking about. But again, there is no problem with incorporating some of those things into an eating plan. Maybe it's the 80-20 rule or something like that.
So basically, there's a lot of ways to be flexible within this to make it work for individuals.
That's exactly right. And that's the benefit of, again, with working with a dietitian and really modifying in one of those situations. Oh, maybe I have a job where I eat out all the time. What are going to be the choices for me when I go and eat out? Because it's not negotiable. I am going to be eating out. So what are the best things I can do? So that's the idea of, again, having a plan that's tailored to you. There is no one size fits all. And it is my responsibility as a practitioner to help you to reach those things that are important for your situation and important for you as well. And things change, people are going to go on different treatments, and maybe things are going to change with side effects they're having or foods that they want or eat or all those types of things. So really staying in tune with that and modifying it as need be, the nutrition plan itself. And again, there's a lot of future research coming out now that we are doing here at our center and across the country. I do want to point out when we talk about supplements, some things that we are looking at are we really like people to have adequate stores of vitamin D in their system. So we do recommend some supplements with that. We do have some supplements that we can recommend for fatigue, but some supplements, even though people think they are natural, again, they're not regulated per se. We don't always know what's in them, and some of them do interfere with treatments themselves. So supplements are another issue to be addressing with your care team and getting direction on that. And just because someone said, again, it worked for them or it was natural, we just want to make sure that that's something that would be appropriate with their situation itself. Future research, we are, again, very interested in things as far as eating patterns and diets that potentially would be helpful in helping with pancreatic cancer treatment. One thing that's getting a lot of research is what we call the gut microbiome, or you may have heard of good bacteria and bad bacteria or probiotics that are in your system. And we are conducting some research that looks at, what types of bacteria in the gut are good and which ones can really help with stopping the growth of the pancreatic cells, and what can we recommend. So that is one area we're focusing on. And then another is what we call the ketogenic diet. And so I'm going to let Gayle give you some information on some things that we are just starting to look at with that, and hopes to get some more information so that we can give people the right type of guidance when it comes to those things.
Thank you both ladies so much for your time. I mean, this has been such an informative episode. And Gayle, Terri, I'm wondering if there's anything we missed, anything else you wanted to add?
I would just encourage people to, again, consider their nutrition as part of their treatment. If their physicians or whomever their caregivers are not bringing that up, to please, ask about that. Do you have resources for a dietitian where you're getting your treatment or not? And really encourage them to be seeking that nutritional guidance.
And the only other thing we didn't really talk about today is that many of our patients with pancreas cancer have diabetes. And so that adds another level of complexity, and certainly another reason to be working very closely with the dietitian in terms of how to best do the nutrition plan so that they're managing their blood sugars along with insulin or oral medications, whatever else might be prescribed from their physicians.
Yes, that's a very important point. And also the idea of, getting pharmacy involved with that as well. And another thing that we really didn't touch on a lot is people may have had surgery for their pancreatic cancer. So that would be a whole other episode perhaps, where we would be looking at, what are some of the things that we're concerned about from that surgery and changing their lifestyle and eating habits for that, and what to do moving on beyond that. So there's always a lot to cover when we look at nutrition and pancreatic cancer.
Well, maybe those are two separate episodes that we can look at visiting in the future, because I think that both of those would be impactful for a lot of patients. Well, thank you ladies so much, and appreciate everyone for tuning in, and look forward to talking to you both again.
Thank you so much for all that you do.
Thank you.